ओम धम धन्वंतरे नमः। रागादिरोगान् सदतानुशक्तान् अशेषकायान् प्रसतानशेषान् औत्सुक्यमोहारिदान् जघान योगपूर्ववैद्याय नमोऽस्तु तस्मै। Let me share. Today's topic is study on impetigo. Impetigo means infection of the superior layer of the skin by gram-positive bacteria. It is characterized by erythematous flakes and yellow crust formation. The patient of impetigo. Impetigo is a common infection of the superficial layer of the skin, epidermis, that is highly contagious and most commonly caused by gram-positive bacteria. In most commonly, it is it most commonly persists as erythematous flakes with a yellow crust and may be itchy or painful. The lesions are highly contagious and spread easily. Diagnosis is typically based on the symptoms and clinical manifestations alone. Treatment involves topical and oral antibiotics and symptomatic care. Impetigo is a common infection of the superficial layer of the skin, erythematous epidermis, that is highly contagious and most commonly caused by gram-positive bacteria. It most commonly presents as erythematous flakes with a yellow crust and may be itchy or painful. The lesions are highly contagious and spread easily. Impetigo is a disease of children who reside in hot, humid climate. The infection may be bullous or non-bullous. The infection typically affects the face but can also occur in many other parts of the body that has an abrasion, laceration, insect bite, or other trauma. Pathophysiology. Impetigo can be classified as either primary or secondary. Primary impetigo involves previously normal skin affected by direct bacterial invasion. Secondary impetigo involves infection forming at a previous skin wound, wound site. Any disturbance of the skin barrier leads to access to fibronectin receptors by GABHs and SRS, which require fibronectin for colonization, trauma, cuts, insect bites, surgery, atopic dermatitis, burns, and varicella are common mechanisms of skin breakdown. Once a lesion is present, self-inoculation to other sites is very common. Malnutrition, immunosuppression, daycare attendance, overcrowding, diabetes, and poor hygiene make one more susceptible for impetigo. Triggers that break down skin and increase susceptibility to infection include varicella, herpes, scratching, lice, burns, trauma, and insect bites. The boy is having impetigo infection. You can see erythematous plaques, yellow crust formation, that will be itching or burning sensation also. There is another patient who is having impetigo infection. You can see erythematous plaques, yellow crust around the lips. There is another patient of impetigo where infection of the epidermis is occurred by gram-positive bacteria. So there is erythematous plaques and yellow crust. If a child is having impetigo infection around the mouth, there is erythematous plaques, yellow crust. Another patient who is having impetigo infection, you can see below the nose there is a reddish or erythematous plaques with yellow crust. There is a boy who is having impetigo infection around the lips. In the hand, you can see impetigo infection. So there is a erythematous plaques and yellow crust. Another patient of impetigo. The boy who is having impetigo infection is usually due to gram-positive bacteria. The infection, the epidermis, and there will be erythematous plaques and yellow crust. You can see extensive infection of impetigo. Person is having infection of the face. You can see erythematous plaques with yellow crust. The child, baby, is having impetigo infection. You can see in the face there is lesions. The another patient is having impetigo infection. So trauma, abrasion, laceration, etc. is prone to develop impetigo infection. Now this child is having, baby is having impetigo of the skin. The lesion is impetigo. You can see erythematous streaks with yellow crust. Again, fresh infection of impetigo. It's also a case of impetigo. There is an infection of the epidermis. You can see here cut or abrasion or laceration will cause the infection of the epidermis and there will be impetigo. So there is erythematous plaques with yellow crust. Another patient of impetigo, the leg, you can see the infection of the epidermis. This is another lesion which is impetigo. Impetigo, there is erythematous plaques with yellow crust. The bacterial infection, the epidermis. Because of immunosuppression also, the patient can develop impetigo. The child is having the cubital fossa impetigo lesions. There is a erythematous plaque, yellow crust. The leg, you can see the impetigo infection, the erythematous plaques and yellow crust. Again, in the hand, you can see impetigo infection. The varicella and diabetes can also trigger the infection. So you can see erythematous plaques with yellow crust. The microscopic picture of the skin. You can see inflammatory reactions. So in this patient, around the eyebrow, there is lesions. The corner of the eyebrow. It's to impetigo. So here, the skin infection is there. Another patient can see impetigo infection. This you can see erythematous plaques with yellow crust. A sure case of impetigo. Again, you can see the skin erythematous plaques, yellow crust, usually due to gram-positive bacteria infection. You can see here the impetigo lesion, base of the finger. Again, in the fossa, you can see impetigo infection. So there is erythematous plaques and yellow crust. Again, a lesion of impetigo. We have seen the child, the skin having lesions of impetigo, that is due to gram-positive bacterial infection of the skin, epidermis. Again, patient of impetigo. The varicella also triggers the impetigo infection. You can see the lesions, erythematous plaques with yellow crust, the sure sign of impetigo. The leg, you can see lesions of impetigo. Again, patient of impetigo, you can see the infection of the epidermis by gram-positive bacteria. So that is the erythematous plaques. Again, a patient of impetigo can see the lesion. To carefully observe that the erythematous plaque is there with yellow crust. This is a patient with in the leg having the lesion. You can see in the chin, the infection is there. So a reddish area with yellow crust to a sign of impetigo. The skin, you can see inflammatory reactions. In the epidermis, there is inflammatory reactions. So you can see the erythematous base with yellow crust to a sign of impetigo. Child is having impetigo infection in the neck. In the gap between the fingers, there is impetigo infection. The skin, you can see erythematous areas with yellow crust, impetigo infection. Today, we have discussed the impetigo, its clinical features and diagnosis. So we can treat by giving antibiotics topically and internally, and by Ayurveda also we can treat. We can use Pittahara, Trimigna, Vajaskara, Rasayana, Jivaniya, Oshadis. We can give Daryavajasava, Dandanasava, Maha Manjishtati Kashaya, Mahatikta Kashaya, Kamadugarasa Vidmukta, Pravala Panjamakarasa, Mukta Panjamakarasa, Pravala Vasma, or Mukta Vasma, Pravala Pishti, Mukta Pishti. You can also give Samanikya also. So we have to follow the Pittahara Ahara Vihara. That's Satya. Thank you for patient hearing.